Hello, everyone, and welcome to Arthritis Talks. I'm Trish Barbado, the President and CEO of the Arthritis Society. Thank you so much for joining us tonight. We know that many people who attend Arthritis Talks are here because they want some help in how to support their own arthritis, but also others who they are caring for. And there are challenges and complexities that come with being a caregiver. And today we are going to discuss some of those different facets of the caregiving journey. We're joined by Tanya Burley from Caregivers Alberta and Dave Barker, an experienced caregiver in Ontario. So nice to have them both here. Before we start, just a few logistics. This webinar is best viewed on a laptop or a desktop computer. And if you have technical difficulties, you can email arthritistalks@arthritis.ca. If you have a question for our presenters, you can submit through the Q&A button at the bottom middle of the screen, and we will try to get to as many questions as possible during the hour that we are together. You can click on the chat icon in the bottom middle of the screen to access the chat, connect with other participants, and the Arthritis Society's chat moderator. If you'd like to close that completely, you can simply click the red X icon, and that will close out that window. We're pleased to continue to provide captioning of our webinars to accommodate the diverse needs of our audience, and you'll see that running along the page. Many questions are received following similar themes, and so we will address those first before going into the live Q&A at the end of the session. Before we get started, I did want to thank our event sponsors, Pfizer, United Way of Winnipeg, and other partners for their financial support of the Arthritis Talk series. All right, let's get started. I would just like to give a warm welcome to Tanya Burley and Dave Barker. Good evening. Dave, let's start with you. Why don't you just tell us a little bit about your experience as a caregiver? What has that been like?
Well, thank you for letting me be part of this. And to be able to share some of my experiences and my wife's experiences in our journey with arthritis. I'm not an expert, and so I'm just a husband of a wife with arthritis. And so the journey has been a long one. She was diagnosed with arthritis when she was 17, and we've been married 47 years. And so, yeah, it's been part of our relationship from the beginning. And I know back then when we were dating and then eventually got married, we asked the question, how are we ever going to live with this? And we were young and in love, and I'm not sure we fully understood what it meant. And we had a lot to learn. But I think a few words have emerged that have really helped us. And the first one is the word tenacity. The experiences meant that we needed to stick with it for the long haul. For me as a caregiver and her husband, of course, it was kind of a daily decision that we were just going to make it work. Going to make it work today, and I get what needs to be done. But it also, another word that came along in this whole thing was the word growth. We learned from doctors and seminars and reading and daily experiences. We're still learning. It's been constant learning over the years. Lots of listening. For me, lots of listening to her and to others who know what they're talking about. So yeah, it's been difficult. It's difficult to see her in pain. The hands, the fingers, the knees, the hips. It was probably the hardest thing of the whole thing. But she suffered a lot in silence, and I'm not sure I always fully understood the extent of that pain, but to see the twisted fingers and the swollen joints, that was tough. There was concern over medications, the side effects. We developed deep trust in her doctors, and we very much appreciate those. And the other thing that affected us in our experience was she was unable to work outside the home. So that meant I carried extra employment. Fortunately, in the career that I'm involved in, I was able to blend uh, a couple of employments, a couple of separate employments together, uh, rooted in my faith community and in the academy. But it did mean extra hours and involvements. But in all of that, I also want to say that in our experience, there were huge benefits as well. Um, and this is not to minimize the pain or anything like that, but it certainly helped me grow as a person. Empathy, that was not always a strong suit for me and for the family I grew up in. But there was certainly growth for me in developing empathy, not just for her, but for all who suffer. And then it was interesting to watch my kids. Um, they were typical kids, and they weren't enthused about chores and helping around around the house, but they learned to care, and they learned to care for their mother and for others. And it was interesting because when she needed to go grocery shopping, and she often couldn't go alone, she needed help. They became very willing to help. And now, as adults with their own children, they have deep empathy for those who suffer, and I think a lot of that was learned in the home. And then one more thing, in the whole, what has the experience been like? We had an amazing community surround us. I'm a community that cared for us. It came through my employment and my vocation and roles, but it was just within the context of that community factor that we were able to journey well. I think in many ways, uh, with the support of others who came alongside. So it really did help the journey for me as a caregiver and for her as a care partner.
Thank you so much, Dave. I love the words tenacity, growth, empathy, community. I think those are really wonderful words as I think about people living with arthritis, people like my mom, who's just riddled with arthritis throughout her body. And I think those are words that she would completely agree with you on. I had we have a question that is a theme in the questions from the audience, which is around flares. So someone is having a flare up, that can be so debilitating and well, both physically and mentally challenging. And I wonder if you could talk a little bit about that.
Yeah, it was interesting when we were going over these questions with our daughter. Her response when we talked about the flare thing was duck and run for cover. And but fortunately, actually, we have not had to deal with a lot of that for the last 20 years. Um, she's been very stable with the medications of methotrexate, and she's been on the biologic Enbrel, and that's just been really, really helpful for her, and has very much stabilized the whole experience. But I do remember those times and years gone by, and when she was immobilized and very limited in what she could do. And frankly, I guess the simple answer is, I just needed to step up to the plate. Perhaps not go golfing as I planned or go play tennis. At times, I had to ask my employer for some extra time to spend at home, work a bit from home, and then we would get some extra help. And as I said, we had an amazing community around us. Um, I'm a prof at a small college, and there were always students who were willing to come along. Our faith community was supportive, and so when there were times when we needed just a little extra help, those people were there to help us out. I also remember the Arthritis Society providing a physiotherapist coming along and coming to the house. And I remember that the therapist counted 11 joints in my wife that were inflamed. And so she gave some help in mitigating some of that pain. But it means making changes, adjusting, adapting. Again, I was fortunate that I was able to make those adjustments. I guess And this may be not directly answering this question, but what I did learn was I am not her coach nor her medical expert. Giving advice was not a good idea. The critical thing was to listen, work hard at understanding, things that I didn't always do very well. But it was not my job to fix the situation. I was to care and listen and just engage our life journey together.
Thank you so much, Dave. That's quite powerful, even beyond arthritis, isn't it?
Yeah.
Having that ability to really just listen and not try and solve the problem, which I think we all jumped to that. So that's really great, valuable insight. Tanya, why don't we turn to you? We definitely get a lot of questions from people who attend medical appointments with their loved one. And what advice do you have for them as a primary caregiver trying to support medical appointments?
Thanks, Trish. That's actually a really great question. So, working with doctors and other healthcare professionals can be a really important part of caregiving. And some of the things that caregivers may find especially helpful to discuss are what to expect in the future, sources of information or support, community services, and ways that they can maintain their own well-being. And in saying that, some tips that I give caregivers regularly when attending medical appointments with their care recipients is to bring a list of questions. So prepare for that beforehand. And start with what's most important to you and the person that you're caring for. And take notes during those appointments. Also bring up a list of all medications and supplements that the one you're caring for is taking, and even over-the-counter medications as well, because we don't always just see our family doctor. Sometimes we're seeing specialists as well, and they may not, always know what your care recipient is on or any changes that have been made. Also, when you're in the appointment with your care recipient, it's really easy to get into a two-way conversation between the doctor and yourself. So try not to do this. Always include both the person that you're caring for and the doctor when you're talking. Also, respect for a person's privacy is important as well. So knowing when to be engaged in that conversation in the appointment and when to leave the room when necessary. And ask the doctor to recommend some helpful community resources. Oftentimes, people will create a small care binder or folder to keep notes that they make at their medical appointments, lists of medications, allergies, and copies of different things like radiology results or any type of other medical information that you may be given from hospital visits or other specialist appointments. This can be a great way to keep yourself organized for those appointments.
That's great, Tanya. Very good advice. We also know that people struggling with arthritis also end up being caregivers for other people in their lives. And I wonder if you have any words of wisdom for people who are living with arthritis, but are also caregivers for others.
Absolutely. So as somebody who suffers from osteoarthritis myself, I can say that almost all people living with arthritis find that it affects their lives in some way. And it can affect their everyday activities or jobs, their financial resources, or their relationships with family and friends. It's not easy to live with, but there is lots that you can do to change, overcome, and cope with any problems that present itself. So if you're caring for somebody while living with arthritis, ensuring to maintain your own health and well-being, attending your own medical appointments, and taking time for self-care is extremely important. So counterbalancing your own well-being with caring for the person that you're looking after. This is also where it's important to set boundaries and know your limits within your caregiver role as well. So, communicating those to your family, to the care recipient, to the medical professionals, and just be honest about what those limits and boundaries are. And also seek outside help for your care recipient to manage the responsibilities and roles that you feel you're not able to do.
That's great. And I think when you mentioned self-care, it really rang true for me as well. When I think about how so many people during this last couple of years have, on top of perhaps their normal struggles physically or mentally, have this added burden and anxiety that is related to the pandemic, which I can imagine it would be extremely difficult. Perhaps you can talk to us a little bit about self care and talk a little bit more about examples of that or ideas that you have in that regard for our audience.
Absolutely. Self-care is absolutely imperative when you are caregiving for anybody, or if you're suffering from an illness yourself. And the reason for this is because caregiver burnout can be so prevalent in our caregiver community, and we want to ensure that we are not getting to that point of burnout. So when thinking about self-care, the things that I can recommend are to take time for yourself and your own needs. Watch for signs of stress, such as impatience, loss of appetite, difficulty with sleep, concentration or memory, and pay attention to your moods. A loss of interest in usual activities, or an inability to accomplish tasks. These are all signs that you need to take time for yourself, and involve yourself in your own self-care. So making sure that you're eating a well-balanced diet, drinking plenty of water, exercising, taking short walks, yoga, meditation, whatever and you enjoy that helps with your physical well-being. Listening to guided meditations or relaxing music can be helpful as well. Schedule short rest periods between activities, and making a priority to get a good night's sleep. People sometimes don't realize how important sleep is, and it can really, really affect your physical, mental, and emotional well-being. Don't overload yourself with daily to-do activities. Be realistic in setting your goals for your day, and be gentle with yourself is really important. So if you're not able to get everything done by the end of the day, just recognize that you're doing the best that you can do. And make sure that you find, several hours during the week for activities that bring you joy, things that are meaningful, whether that's engaging socially with other people or reading a book or, art, doing things that, that are helpful for you to escape from the stressors that you're facing every day. And one of the biggest pieces of advice that I can give is to accept help when offered. A lot of times caregivers have a lot of difficulty accepting help, but it's really important that we accept that help when offered so that we are not overloaded and burdened every day.
That's great, Tanya. Thank you so much. We had a question that related back to the appointments, and I think it's worthy to ask you this. And I have this horrendous story of my 82-year-old mother and my sister having to drop her off an appointment during COVID where she could not attend the appointment with her. And in fact, ended up being separated from her. She doesn't know how to use a phone. And they spent 4 hours trying to find my mother somewhere in this hospital. I mean, it was quite unbelievable. So do you have any advice around where the medical appointments, based on whatever province and whatever state we're in, there's certain restrictions to supporting your caregiver. Do you have any experience with that and suggestions for us?
There can be certain restrictions. COVID, for one thing, has presented a lot of challenges when it comes to attending appointments and attending or visiting loved ones when they're in the hospital or in a care home. Communication is really important with the medical team that is providing care for your loved one. If you're not able to attend an appointment with your loved one, ensuring that you're communicating with the medical office to let them know that you won't be there in attendance, and ensuring that you are arranging appropriate transportation for your loved one to and from the appointment if they can't take themselves. There's often, I know in Red Deer, Alberta, where I live, we have a service that is for seniors or people with disabilities. They will arrange a time to come and pick up your loved one, and they will also be there to pick them up afterwards and bring them home. So making sure that they are looked after in that regard as well is really important.
Thank you, Tanya. Thank you both for your expertise. I think that that your comments are really valuable. So we're going to move into some Q&A, but perhaps I'll give you each a moment just to give any final comments or thoughts. And why don't we start with you, Dave?
Yes. Okay. Yeah. Some final thoughts. I think an important point to remember: it's a marathon, not a sprint, and that's the word tenacity. We're in for the long haul. It's a daily reality that we say we're going to do well on this today. Another thing, I think it's a journey, not a destination, not an arrival. This probably will pursue and be part of our life for months, years, maybe almost a lifetime, as it has been for my wife and me. And then critical words like listening, learning, self-care for sure, and companions on the journey are really helpful for me in understanding my role in this task.
Thank you so much. Tanya, how about you?
The only thing that I would like to note is that with caregiving, it's not usually or often something that we expect to be a part of, and sometimes it's not something that we necessarily want to do. But realizing that caregiving for a loved one can be very rewarding and beneficial for the person that you're caring for. So when you're having doubts about caregiving or the role that you're doing, making sure that you're communicating with your family, with the care recipient, and coming up with a plan in terms of what those roles will be, how that will look like, and see if there can be some shared roles along that journey.
That is wonderful. Thank you both. So I think we'll move into the Q&A. So for our audience, feel free to put in your questions, but I will start and give each of you a few here to get going. Tanya, we had a question around a family member that is living on their own, but increasingly becoming less independent in managing daily activities. And I know that this is definitely a stressor for people who are, for example, watching their parents or in-laws age. There are concerns with safety, but of course you want to give them their independence. They may not want you to come and help them. They may not welcome that. So what are your recommendations in a scenario like that?
Well, aging, of course, is scary for a multitude of reasons, and that fear can manifest in a refusal to participate in doctor's appointments and medical treatments. And this isn't uncommon, especially with people who are wanting to age in place in their own homes. Some individuals have always been wary of doctors, hospitals, and medications, while others can become distrustful over time. And it makes sense that an aging loved one might refuse to go to doctor's appointments because by avoiding them, that person can dodge any new diagnoses or information about their status of their existing health conditions. And while ignorance is bliss, approaching aging is somewhat understandable, and it happens to be a major source of frustration and anxiety for family members. And our job is always to ensure that our care recipients' health and safety is taken care of. But we can't do that without a clear picture of their current physical and mental health, of course. But the truth is, unfortunately, a person who still has the capacity to make decisions for themselves have the right to refuse medical treatment. So if a senior or a care recipient is competent and capable of informed decision making, they can manage their own health in any way that they choose. And this can be really stressful and frustrating for family who just want to care for their loved ones and want to help, especially if they're starting to see some things that are concerning around safety. But although as adults we've earned the right to make our own decisions, oftentimes once competent elderly family members or once competent loved ones, progress in their disease or their illness, they can often not think as rationally as they used to, and can begin making decisions that are unwise. So when you know in your heart that the time has come to step up and ensure that your loved one gets care, there are certain things that you can do, or think creatively about how to make that happen. So look into house calls. See if the family physician will make house calls or telemedicine over Zoom. Or you can sometimes use, depending on the situation, sometimes some therapeutic fibs, in a sense, to get them to go to the doctor's office. We normally don't recommend that unless there's a dementia or Alzheimer's, but there's no shame in guaranteeing your loved one gets proper medical treatment. And sometimes we have to do some things, that we normally wouldn't do to make that happen. But most importantly, respecting your loved one's right to determination.
I might add on to that, Tanya. I think about the 25,000 or so kids and teenagers across the country who have arthritis, and they really just want to be normal. And you can imagine the anguish of a parent getting this diagnosis when they didn't even think that kids got arthritis. And it's so hard to explain it to your friends because they've never even heard of it. It's just seems so, and often it's invisible. I mean, you might have the swollen joints, there might be some, but for the most part, they're in a lot of pain and you can't really see that. You can't see what is happening to them. And for a parent, they just want to be normal. So they are going to be willing to take more risks and that sort of thing. Any advice on that front?
Well, as a parent who had children who developed mental health illnesses, which is different than arthritis, of course you want things to remain status quo and normal, making sure that your child has normalcy in their life, both at home and at school and socially. So especially depending on the age of your child, making sure to communicate with your child about what they feel that normalcy looks like for them. And when it comes to yourself, I mean, there's no right or wrong way to approach how you talk to your family and friends. It's going to be what you feel comfortable with, what you and your child would like to divulge to family. So it's really, um, it's different in every scenario. So it's really hard to pinpoint a really great advice in terms of that and exactly what you should do. Um, but yeah, I think just coming up with a plan as a family to determine what that's going to look like is a great way to start.
Hmm. Dave, what about you, sort of on a similar vein? Have you had situations where yourself or other family members sort of disagreed with a plan of action, or your wife disagreed with you, or you had certain concerns? I mean, maybe you can talk a little bit about how you navigated that.
Yeah, that's a tough one. I would like to be able to say that my wife and I agreed on everything all the time about how to proceed, but no, that didn't happen. But hmm, the key word is listen. Hear hear what they have to say and try to understand why and how they are thinking this way. Um, so often, perhaps we jump in a little too soon and a little too quick with our thoughts. And it's called empathy. And empathy starts with listening to the other person and trying to kind of fill in the gaps as to how and why they're thinking the way they are, saying what they're doing, or want to proceed the way that they do. And then after that, again, after hearing that, maybe with some response, but not much, then wait. Often things don't have to be decided right away, and just listen, just wait. And sometimes it takes time for ideas to change, mindsets to change. It may be our part as caregivers that we've got to have a little time to think through how to proceed. There's a wonderful. I just finished reading it a little while ago. Brian Goldman, who is an ER doctor in Toronto here, has written a book called "The Power of Kindness: Why Empathy is Essential for Everyday Life." And I wish I had this book. I wish I'd had that 20, 30 years ago. But that's been an extremely helpful read in moving. And he takes us from where we start so often with sympathy, but that tends to be, okay, I feel sorry for you, but there's not a lot I can be doing here, to empathy and the various kinds of empathy, cognitive and other kinds of things. And then he actually goes into a third, which is called synchrony, in which and he uses the illustration of what two people sitting in a coffee shop, and they start mimicking each other in voice inflections and body language. And I found that extremely helpful especially in that notion of listening and then waiting. And then after time, sit down again, talk about it, and inevitably things kind of sort themselves out after a while.
That's great. Maybe I might stick just to this point a little bit around for yourself as a caregiver. And I'm a golfer, so I loved your example about not being able to golf, because I thought, okay, that would really make me upset. So how do you deal with those times where, as a caregiver, it's fine to have empathy, but your life is being impacted? Yes, it's very rewarding. Obviously, you have a wonderful relationship with your wife, but there have to be times when it can be extremely challenging. And I'm just curious about how you have been able to manage that over the years.
Yeah, well, first of all, it had a lot to do with her, so I'm grateful for that. But in her grace in handling a lot of that. But the other critical thing, y- um, asking for help. Um, don't be afraid to ask for help. I mean, Tanya mentioned that, and sometimes it was just, you know what, I just got to reach out and ask someone to come in and help, take some time, and I might be able to go off and have a game of golf or go for a hike, or I'm a cyclist, go for a ride, and that kind of thing. So that has a little bit to do probably in the domain of self care, but again, I'm coming back to my word community and the ability to reach out to others who can give you a little bit of relief and not reach that point of frustration, perhaps even anger, resentment. It's there, it comes. I would never say that I've never been in those places, but we both knew that maybe at that time we need to call someone in just to take a little of the weight off my shoulders and allow me to just have a little time alone or do kind of my own thing.
Tanya, maybe you can also comment on this area around, in particular, where people may not be able to draw on their immediate family or friend circle, and they're really looking to get professional respite in or get that kind of help. Guess a two-part question. I mean, one, how do you broach this with the person that you would like to do this? How do you get them comfortable that they're going to have an external caregiver potentially? And then how do you even go about that? I can expect that for a lot of people, this would seem like a very overwhelming task, even to find the right person to help.
Hmm. Yeah, that's a really good question. Accepting personal care from a stranger is not an easy choice for anybody. And um, the decision to bring in respite care or a professional caregiver um, is is a decision that is not easy, and certainly something that you need to take great care in approaching your care recipient, your loved one, in. So, therefore, choosing the right time to have that discussion, um, time and place, ensuring that there's not a lot of distractions around, or that they are not in a place where they're experiencing a lot of pain or, you know, tired. So making sure that they are in the right headspace for that type of conversation is really important. And ensure to do some research first. So um, connecting with your local healthcare. Here, ours is provincially in Alberta. So in Alberta, we would contact Alberta Health Services. You can speak to somebody in continuing care or home care, and they can set you up with either somebody to come in and do some home care activities, or speak to you about what types of respite care is available for you, how many hours you can get, and who would be coming into the home. You can also look into private respite services. Um, I know one example, I had a family whose her parents were not at all open to having anybody come in for respite or caregiving. And they were from, they were, they had lived in Canada for, I think, 8 or 10 years. And they were from a different country, a different culture. So reaching out to those cultural organizations and saying, do you know of any caregivers, you know, from this community that um, would be a great choice to bring into our home? Um, because sometimes culture is an important factor as well. Um, so in that instance, I was able to find a caregiver who came from the same cultural background. And one of the things that in that culture, food is a great way um, to connect. And so that caregiver had arranged to come over just for coffee with the care recipient and the loved ones. And she did some cooking uh, for them. And the food was a great way to initiate conversation and provide that comfortable atmosphere. So, even if it's not a cultural instance, looking into and interviewing different respite providers or care providers and finding some way to slowly bring them into the home and in the situation, a slow introduction, um, trying to find out if there's some similarities in interests between the care recipient and the respite provider that they could share as kind of like an icebreaker can be helpful as well.
Yeah, that's great. That's all very helpful. I know we had talked about boundaries. I think both of you had touched on that. And maybe, Dave, I'll turn to you on this. Do you have any advice or recommendations on boundaries? Like, are you able to kind of sort out when you are getting stressed out, or have that ability to be aware and know what to do? Maybe you could talk a little bit about your journey as a caregiver around that area of boundaries.
Yeah. That's a hard question because, especially in my relationship, we're husband and wife, the boundaries are fluid. And, at what point are you trying to be a good husband to your wife, and she being a good wife to you, and developing that partnership that's found in a marriage relationship, and then but then moving into the role of caregiving and functioning at that level. And so those boundaries are often, for me, quite fluid. But I found that when I was starting to get irritable, annoyed, maybe a little more quick-tempered than I should be, that was the time to find help. And so again, we had a community around us that was really helpful. We had neighbors that understood really well where we were. I had an employment situation that was very sensitive to our situation. And so I was pretty quick to step aside, get a little time to myself, bring someone else in. And I think a huge area. And I was interested in what Tanya had to say when you were asking her about bringing someone in, maybe from the outside. And she talked about cultural communities. I could talk about faith communities. Trust is such a huge factor, and it often takes a little bit more time to develop that trust. But in a situation I was in recently, both my parents are aged, both are gone now, but we needed to bring in help. We just couldn't do it, my siblings and myself, and so we were able to bring in help. And I found Tanya's comment about food to be really important. One of the things that these folks did was prepare a meal, and that just especially my dad, won my dad over. Trust in the cultural, in my situation, the faith situation, and that it actually developed into really a deep friendship between my dad and the health and the caregiver that came into the home, and we are extremely grateful for that. But back to the boundary thing, you've got to know when you've kind of reached the end of your tether, and you're going to start doing more damage than help. And again, finding that sense of community. And by the way, it takes time. You don't build a community in an instant. You develop this community of care and people who are aware of your situation to help you out. It takes a little bit of time, but once it's there, often it's a very, very helpful resource to call on and call on quickly.
That's great, Dave. Tanya, just another question from the audience, and going back to parents who have children with arthritis and are worried, as you would be, about their care if you were to pass away as the parent, and who can be there to support them. And just wonder if you have any comments or feedback on that scenario.
Well, I think that's, in any parenting situation, that's something that we need to think about. You know, just as parents, if something should happen to us, because anything can happen any day. So ensuring that you have had conversations with family or friends that may wish or be able to take care of them in the instance that you pass away. And ensuring that you have your legal paperwork in order, like your advanced care planning documents, your personal directive, your power of attorney, and of course your will, because all of these things will be a part of those documents as well. So the best thing that you can do as a parent is be preventative. Start planning now for an event like that, and making sure that you have, somebody that's going to be able to take care of your child in any event that happens.
That's great, Tanya. I think it will be okay to wrap up maybe a bit early. So I have one more question for both of you, and it really is just if you have, for our audience of caregivers, what would be one piece of advice or recommendation that you'd like to end with tonight? And Dave, perhaps we'll start with you.
Yeah. Okay. So, we've talked about the importance of self-care, and that's a critical factor in the whole thing. I've tried to emphasize community, whether it's a cultural community or a recreational community or some kind of maybe a neighborhood or that kind of thing. And I just have found those to be extremely important. Another factor, and we have to be a little bit careful with this one in caregiving, because two's company, three's a crowd, and I understand that. But sometimes it's really helpful to have a confidant that we can talk to. Not to betray secrets, not to betray, not to create an environment where it's just a complaining situation or something like that. But sometimes I have found to be able to sit down with a friend or maybe a mentor or a respected colleague or someone like that, just to not so much to vent, but just to ask advice, seek help, get another perspective. Perhaps when you get into that situation where you and your care partner are disagreeing on the next step, okay, to go to another person and say, okay, I'm struggling with this, I'm not quite sure where to go, and just get their perspective and their advice. Now, again, we got to be really careful with that one. I would never do that without my wife knowing about that. I wouldn't want to go behind her back or betray her in any way situation. But at times she would say to me, well, why don't you go talk to so-and-so, or why don't you seek some advice from this person? And sometimes that same person would be the one that would be talking to my wife as well. So that notion of bringing someone into your world and your worldview that you respect, for wisdom, for common sense, who knows you well, knows both of you well, and can help you maybe journey through some of the more difficult decisions and and inevitable conflicts that happen in the journey together.
That's great. Thank you. Tanya, I'm just going to ask one more question from the audience, but then you can also do your recommendation. And that is around where you have a situation, say with a couple where one does have very debilitating arthritis, but the spouse, who's also a caregiver, has their own health issues, whether they're heart issues or diabetes or other things that they need to manage. So there's this kind of mutual caregiving role and mutual need for assistance, and there's a lot of stress probably on both parties with that. And I wonder if you could comment on that situation.
Absolutely. So this is where boundaries are really, really important. Because it's essential to know how to take care of yourself, as well as the person that you're caring for. And when you have two people that have care needs, it can be really challenging to be able to not only look after yourself, but look after the other person as well, and looking after each other as well. So ensuring that you ask for outside help when you need it, knowing your limits, again, like I said before, recognizing those, and asking for help is really important, because you can't do it all, and you're really at risk for harming your own physical well-being. And compassion fatigue and caregiver burnout are also things that need to be prevented as well. So yeah, I just talking to your care providers, your family, your friends, and being willing to accept that outside help to come in.
Well, that's great. Tanya, David, thank you both so much. This has been fabulous, and I've learned quite a few things myself that I will be taking back as well. We'd just like to take a few moments with our audience to get your feedback on the presentation today. So if you are watching through Zoom, you'll see a poll question, which will come up on your screen with some answer options, and just encouraging you to respond to an answer that reflects how you're feeling. The question is, did you find the information in today's webinar helpful to you? I will just give you a minute to complete that. And if you were unable to access the poll question, you will have another opportunity to provide feedback when we send you an evaluation form. We'll send you an email with the recording of the session today. And we definitely use your feedback to shape our Arthritis Talk series and get a sense of what you are interested in hearing more about. So we really, truly value your input. So once again, we're really grateful to our partners, Pfizer and United Way Winnipeg, for their support at this event. And the Arthritis Society really does rely on donors to fuel all of the programs like Arthritis Talks, but also to invest in many things, including information and support and education and vital research. So if you're able to make a gift, you can donate online at arthritis.ca/donate. We will be back in January with Arthritis Talks, and it will be arthritis in the hands and feet. So I will be interested in that. And for more information on that, you could go to arthritis.ca/arthritis talks. And this will conclude today's Arthritis Talk, Strategies for Caregivers. I'd like to just say on behalf of the Arthritis Society, thank you so much for joining us. I really hope that each of you has a really wonderful holiday season, that you have time to take care of yourself, for you to really celebrate and be grateful for all of the wonderful things that you have, and for your loved ones, and for community, and for all of those important things that we have in our lives. So I want to thank our speakers, and thank you all for joining, and I wish you a wonderful evening. Bye-bye.